As there are more older patients, these patients are going to be living more at home. They're going to want to age in place, and their needs, their personal care needs, are certainly going to grow as a consequence. So the need for home care workers is exponentially rising.
Home attendants are so key in the personal care of the patient, feeding the patient, cleaning the patient, reporting any new symptoms, advocating for their patients. And it's so key because often these patients can't advocate for themselves. So home attendants play a really huge part of that. The other thing is that when they develop a relationship with a patient, they have a very intense personal knowledge of the patient. So they're a great source of information for when patients may be subtly different, but importantly different, which could be the key to a new diagnosis or a new symptom that we need to aggressively handle.
I don't think most of my patients would be able to live at home if it weren't for their home healthcare workers and home aides. And in a very fragmented healthcare system where you have patients in and out of hospitals, where you have patients interfacing with multiple doctors, oftentimes when they have a cognitive impairment, the patient is unable to speak for themselves, then the home care worker really becomes the continuity and becomes the link for all of us in the system.
I had a patient who had the same home attendant for about 5 years, and she was very ill with advanced breast cancer, was bedbound, depended on her home attendant for everything, from feeding to transferring to changing her diaper. And you have to develop trust in that situation because the patient is so vulnerable. And over time, the patient was actually quite estranged from her own family, but became so close to the home attendant and actually the home attendant's family. So at Thanksgiving, the home attendant would bring her family over to the patient's home to celebrate Thanksgiving with the patient, and they really developed an amazing rapport. And when the patient died, the home attendant was there with the patient, and I think felt the loss as much as a family member would feel the loss.
I think it's vital to think about these workers in terms of how to improve their compensation, their training. This is really the largest growing population of healthcare workers in the country.